Good morning. This is a short video on the last part of the second chapter, which is the social organization of nursing work. We know that hospital is an organization and individuals form groups, and inside the organization, which is the hospital, there are groups of people who are working. They are the doctors, nurses, other paramedical workers, and patients are also there. Okay, these are groups of people, and together they form the organization, which is the hospital. So there is, in the organization, the people who form the organization are of different sexual composition. There are males, there are females, and then they have cohesion or unity when they work. There is a leader who leads the organization. There is a structure to the organization. There are divisions of labor. That means some people do on particular work, and then there is a communication system between the people who work in the organization. So hospital, which is a social organization, has different groups of people, as we already said: doctors, nurses, other paramedical workers, and together they form a team. And just like any other organization, the success of a hospital depends on the team members. They should work as a group, and there should be division of labor. There should be a structure and cohesiveness, that is, they should work together, and there should be proper communication. Then the hospital will be effective. If these structure and other things are not there, then the hospital will be ineffective. And just like any other organization, there is a relationship between the people who work in the hospital. First, let us see the relationship between the doctor and the nurse. A doctor and the nurse are the people who spend the maximum time with the patient, and they are the ones who give a lot of treatment for the patients. The doctor diagnoses and the nurse gives the medicine and makes sure that the patient is comfortable and happy. So the relationship between the doctor and nurse should be good for the success of the hospital. There should be a professional relationship, and ideally they should be equal. But in our society, the doctors play a more higher role and the nurses play a more subordinate role. But this is true mainly in the smaller hospitals and nursing homes. For example, in a small nursing home where one doctor owns the nursing home, the nurses work under the doctor. Here, the nurse will actually do whatever the doctor tells her to do for the success of the patient care. So that is called obedience. But at the same time, in a large hospital where hospitals and nurses are very highly professional, each of them have their own specific role, and there is no conflict of interest. There is no problem between the doctor and the nurse. They play a equal role. But if the doctor and nurse have unpleasant situations, then the person who suffers will be the patient. So usually there is a professional equal relationship between the doctor and the nurse, but in our Indian society the doctors have a higher role to play. The next is the relationship between the nurse and the other health practitioners. A nurse is a paramedical worker. There are other paramedical workers like pharmacists, lab technicians, physical therapists, health technologists, social workers, x-ray technicians, and all the others. All these paramedical workers have a similar role. They all have to work together in the hospital for the welfare of the patient. They again should have a professional relationship, and they should have a equal relationship. For example, if the nurse fights with other health professionals, then the patient care will suffer. So for example, if a patient is in a ward, a lab technician may come to the ward to take blood of the patient, and an x-ray technician can come to the ward to take x-ray of the patient. So here both the nurse and the other health workers, if they have a good relationship, then the patient will benefit because they will work as a team. Whereas If they do not work as a team, and if they compete with each other or fight with each other, then the patient will not benefit from that kind of relationship. So the nurse should have a good relationship with all health workers, because each profession depends on each other, and finally the teamwork will work for the benefit of the clients or the patients. Next, we will see what is the relationship between the nurses. You know, the nurses who work in a team are always professional, and if they have, that means they work in the hospital as professionals and they relate to each other. And in the evening, if they are friends, then they can have a non professional social relationship also. For example, if five nurses working in the same ward are close friends, then in the morning time they will work in the ward, evening they will go shopping together and they will go and eat out together. So that is a social relationship. And while they are in the workplace, they will not bring that social relationship. Instead, they will be having professional behavior. And another thing is, the nurses in a hospital or in all the hospitals together, they have associations. So all these associations are other aspects of the relationship between the nurses. One important thing about the professional nursing relationship is, each nurse, when she finishes her shift, she will give a report of the patient in the ward to the next nurse who comes on the next duty shift. For example, if a nurse works from 8 in the morning to 4 in the evening, she will hand over all the patient details to the next nurse who takes over the duty at 4 o'clock in the evening. That nurse who takes over at 4 again will report everything about the patient to another nurse who takes over in the night. So this way the care of the patient is continuous and there is no gap in the treatment. So every nurse will know what medicine the patient has been given, whether the patient is comfortable or whether the patient is having any serious health problem. So that will help the patient to benefit from this relationship, which is professional in nature. Then the next relationship is between the nurse and the client. Here the client is the patient, because hospitals these days do not call patients as patients, but instead they call them as clients. So we have already studied how a nurse should be in this chapter. A nurse should be compassionate and show concern and have empathy for the patients. The nurse should also be able to communicate properly with the client. Then the nurse will know whatever the patient is suffering from. Other than having a communication and relationship with the patient, the nurse should also have a good relationship with the relatives of the patients. Then the nurse will be able to give good care to the patient. The patient and the relatives will also be able to tell all the problems they are facing to the nurse. This will help the patient to have a comfortable stay when they are in the hospital. So ultimately, the benefit goes to the patient. So in any relationship between a nurse and a patient, there are three parts. First is the beginning, where the nurse actually forms a relationship. They come into contact with the patient and they introduce to the patient. Then during the middle, the nurse delivers health care to the patient. And finally, the nurse also empowers the patient, so that when the relationship ends, when the patient is getting discharged, the patient is not dependent on the nurse. Instead, the patient is empowered so that they are able to take care of themselves, so that when they go home after discharge, they do not need the care of a nurse. So if this process is continuous, then the patient will be able to benefit from it, and they will have good physical, spiritual and mental health when they get discharged from the hospital. So in conclusion, what we can say is, the nurse has a social organization, that is hospital. She is coming in contact with the doctor, the other healthcare workers, other nurses, and finally the patient. So all these relationships should be professional, and it should all the members of the team should work in cohesion with each other. This will help the patient to benefit. if there is any problem between any of these people, then the patient is the one who will suffer. So in future there should be more equality in the profession between physicians and all other health workers. That will help the patient to benefit much more, and this will help the patient to have a good recovery and go back to his normal lifestyle. So with this we come to the end of the second chapter. We'll start the third chapter soon.